Hello guys, today I'm just going to review what is gestational diabetes. Gestational diabetes, which is GDM, is a condition of high blood glucose, sugar, occurring during pregnancy. According to the Canadian Diabetic Association, GDM occurs in 3.7% of non-abortional women and varies from 8% to 18% in abortional population. GDM usually develops around the 6th month of pregnancy. Women with gestational diabetes can have a very healthy babies, especially when it's diagnosed and treated in a timely manner. Why does it happen? Gestational diabetes can occur because of normal hormonal changes in pregnancy in relation to other factors. The hormonal changes. In your body, the pancreas produces insulin that works to move the glucose from your blood into the cell to provide them with energy. This supplies the basic energy for your body. When you eat, your blood glucose raises only a little as your pancreas releases insulin, which results in a glucose moving into your cells. The hormones made by placenta causes your cells to be less responsive to your insulin. As your pregnancy progresses, your placenta grows, producing more of these hormones, and therefore less insulin is able to work. Most women are able to increase the amount of insulin they release to cope with this, but if they are not able to, the glucose level in blood will raise. This usually happens around 24 to 28 weeks of pregnancy. Once the baby and the placenta are delivered, there are no more of the placental hormones, and the amount of insulin you need falls to what it was before your pregnancy. So your diabetes disappears in most women. Risk factors. Some women are greater at risk of developing gestational diabetes. Risk factors include being from ethnical group at high risk, which could be Asian, South Asian, African, and etc. Body mass index, which is BMI, over 30 kilogram could cause it. Being over 35 years of age or older. Having had previous pregnancy with gestational diabetes. Having a baby who weighed over 4 kilo or 400 gram or 8 pounds and 13 ounces. Polycystic ovary syndrome. Acanthosis nigricans, corticosteroid use. Sorry if I'm pronouncing them wrong, since I do not know the medical terminology. And what are the symptoms? Most women do not have symptoms of gestational diabetes, which is why it's important that women be screened. You may have noticed a vague sense of fatigue. Your cells have less glucose to make energy. You may have noticed an increase in the number of times you need to urinate, particularly at night, or an increase in your level of thirst. On occasions, there may have been sugar discovered in your urine on a routine obstetric visit. As these symptoms may be related to something else, you should be discussing them with your doctor. And why are diagnosis and treatment important? It's important that gestational diabetes be diagnosed and treated as soon as possible to promote normal growth for the baby and to avoid problems at birth. Normal baby growth. If blood glucose is high, the glucose crosses the placenta easily and the baby receives more glucose than necessary. However, the mother's insulin does not cross the placenta to the baby. So the baby produces extra insulin to bring its own blood glucose back to normal. This combination of extra glucose, example food, and insulin or growth hormones, can result in a baby growing larger than normal. If babies become extra large, microsomic, delivery can be more difficult for both baby and mother. avoid other problems. If your blood glucose is high before and during labor, it may lead to a high level of insulin being made in your baby before delivery. Once the cord is tied, the baby does not get your glucose anymore, but the baby is immature and cannot slow the amount of insulin being made very quickly. This means there is a risk that the baby's glucose will drop too low. Hypoglycemia is in the first few hours after birth. The baby's blood glucose is usually checked after delivery, and if it's low, early and frequent breastfeeding or bottle feeding is usually that all it's needed to bring back to normal. In some case, the baby may need to go to a special care unit for intravenous fluid to correct the low blood glucose. Jaundice, yellowing of skin after birth, may occur more frequently in babies born to mothers with gestational diabetes. However, this is temporary conditions that's readily treated. How is gestational diabetes diagnosed? The routine screening test for gestational diabetes is generally done between 24 to 28 weeks. Doctors may suggest the test to be done earlier if you have several risk factors. The preferred method of diagnosing GDM is to a screening test consisting of sugary drink followed by blood test 1 hour later. In the result, it's 7.8 mmol-L or higher. The oral glucose tolerance test OGTT is done. Another glucose tolerance test is done first thing in the morning after an overnight fast. No food or drink except water after midnight or for 8 hours. A blood sample is taken and the glucose drink is given. Further blood tests are taken 1 and 2 hours after glucose is given. Gestational diabetes is diagnosed if one or more values are the same or higher than those in the chart below. So oral glucose tolerance. Glucose fasting should be less than 5.3. After 1 hour, it should be 10.6. After 2 hours, it should be 9. A second method of diagnosing GDM skips the screen and So second method of diagnosis GDM skips to the screen and goes directly to the OGTT. If this one-step method is used, a diagnosis is made when one or more of the values are the same or higher than the chart below. So looking at the chart below, the oral glucose. So the oral glucose fasting, it should be 5.1 after fasting, and then after 1 hour it should be 10 or less, and then it should be after 2 hours 8.5. What is the treatment for gestational diabetes? There are many different ways to manage the gestational diabetes. However, the goal is always the same, to attain target glucose level while maintaining the health of both mother and the baby. The treatment of gestational diabetes usually involves seeing a team of nurses, dietitians, and doctor every 1 to 4 weeks until the baby is born. Individual assessments as the pregnancy progresses is vital and involves the following aspect: healthy meal plans. Healthy meal plan is a primary treatment for gestational diabetes. The goal of the meal plan are to provide adequate nutrition to the mother and the baby to ensure appropriate weight gain, distribute food intake throughout the day to control the blood glucose. A dietitian will help you choose the right kind of amount of food for your needs. You may be asked to record what you eat each day to help evaluate your needs and blood glucose level. General guidelines include: eat smaller meals at breakfast, lunch, and supper. Include snack between the meals and at bedtime. Try not to skip meals or snacks. Eat healthy, high fiber, low fat foods from every food group every day. Avoid fruit juice, fruit punch, or sugary foods such as sugar, jam, honey, chocolate, cakes, donuts, and pastry, and etc. Ketones. If your blood glucose is high, food intake should not decrease. Speak to your dietitian. When your body cells do not get enough glucose from food, the body breaks down its fat stores as a source of energy. Fat breakdown produces ketones, which is not good for the baby. You may ask to check your urine for ketones in the morning before breakfast and possibly other times of the day to help ensure you are getting enough energy in your meal plan. If you are breaking down fat producing ketones,